Francis, Eric Sakwa, and Japhet Odera, Jane Kagwanja, Faith Mbide, Jemima Inema, that's all the way from Congo. We also have Femi Atieno and the one and only Martin Chironga. And therefore today, ladies and gentlemen, we want to be talking of different things. Don't worry, because you'll be interacting with people, intellectuals, smart minds, fast learners. Let me not talk more. So join me, ladies and gentlemen, as we gather knowledge from different people from all over the globe. Remember, Jemima Inema, you'll learn from her English. Super girl, speaking certain good English. You also hear from the one Dr. Japhet Odera. You'll also hear from Jane Kagwanja. This was once a teacher, and many more. So ladies and gentlemen, welcome. Sit back, relax, and enjoy the show. Let's go. So, I don't know if Madam Jemima, you are in a position to hear me, because I want you to come and explain something.
My name is Imani Jemima, and I will talk about communicable diseases. Communicable diseases are illnesses that can be passed from a person to another. They are caused by germs such as bacteria, viruses, parasites, and fungi. These diseases spread through different ways, including air, water, food, body fluid, direct contact with infected people, or insect bites. If proper prevention measures are not followed, they can spread quickly within communities.
Thank you so much. That's one and only Jemima. No. Now, allow me also call the one Faith Mbide. I don't know if you can get me clearly, Madam Faith. I want you to talk about this, some of the examples of the common communicable diseases, and also their mode of transmission. If you're getting me, please.
Communicable disease. So one example is tuberculosis, which we call it TB, and it spreads through the hair when an infected person coughs or sneezes. Second one, we have cholera, which spread through dirty or contaminated water. We also have typhoid, which spread through contaminated food or water. We also have malaria, and it spread through mosquito bites. We have also flu, influenza. It's called influenza, but it's flu, and it's spread through droplets in the hair. And then I'm going to give you another example. If one student with a flu coughs in a crowded classroom like this one, without covering their mouth, definitely it will be very easy for students who are around that one student with flu to catch the disease. That's why we call it communicable disease, because it is spread through one person to another, through hair, contaminated water, food, blood fluids, as my friend had said.
Okay. Thank you, Madam Faith Mbide. Thank you for your time. And I'm also nervous because I'm trying to reach out on Feni Atieno, who will also be talking of something different. That's the diarrheal diseases. And I want her to define so that maybe we understand what this is all about. Maybe she can talk of the causes. So, Madam Feni, wherever you are, I don't know if you're getting me. Okay, go on.
Good morning. I'm Atieno Feni. I'll be taking you through diarrheal diseases. Diarrhea is a condition in which a person passes wounds or watery tools frequently or more often than normal. Okay, when you go to the causes, they are mainly caused by the germs, e.g. the bacteria, virus, and parasites found in contaminated food or water. We have another one, food intolerance, e.g. the lactose, We have a certain medication, especially antibiotics, and digestive disorders, e.g. irritability bowel syndrome, also causes it. We also have chronic inflammatory bowel disease, also causes it. When you go to the types of diarrhea, we have acute diarrhea. It usually lasts for a few days, and its main danger is dehydration. The second one, we have the persistent diarrhea. It only lasts from 2 to 4 weeks, and it can lead to malnutrition or loss of weight. The third one, we have the chronic diarrhea, which lasts more than 4 weeks and keeps recurring. Complication mostly is still dehydration.
Okay. Oh, thank you, Madam Fanny. It was wonderful. I've had you talk of the types of diarrheal diseases, the acute diarrhea, the persistent diarrhea, the chronic one. So thank you, Madam Fanny. Thank you for your time. And so I promised people that I'm going to bring on board somebody who is experienced. That's none other than Madam Jane Kagwanja. This is a former teacher. You know, this an experienced lady, full of experience, and whenever she speaks, I can hear wisdom. So let me try and connect her on the line, because she'll be talking about the key interventions on how to prevent these diarrheal diseases. So, Madam Jane, I don't know if you can get me. We are waiting for you.
Morning. My name is Jane Kagwanja, and I'll be taking you through key interventions to prevent diarrhea diseases. Diarrhea diseases can generally be prevented by improving hygiene, sanitation, nutrition, and access to safe water. This can be done through the following: safe water supply in households as well as in communities at large, proper hand washing, which prevents ingestion of disease-carrying germs, improved sanitation, that is use of clean, hygienic toilets and latrines, and proper disposal of human waste, having proper sewage system. Food hygiene and safety, which involves clean, fresh food, well-cooked food, especially from animal products, and well-stored food to avoid toxins. Exclusive breastfeeding for babies for the first 6 months, which boosts immunity and makes sure that they have the protective antibodies. Vaccination, which is a preventive measure, and this can be done against diseases like rotavirus and cholera. Good environmental hygiene, ensuring proper garbage disposal, control of flies and other disease-carrying insects, clean homes and surroundings. Health education, promoting awareness on hygiene practices and diseases, and also encouraging early treatment where one is sick. Proper adequate nutrition and supplementation. Thank you.
Okay, thank you so much, Madam Jane Kagwanja. And finally, I'll be bringing in the one, Daktari, and you know, this wonderful man who have worked in most of the organizations. So I believe this man, the one and only Daktari Japhet Odera, will be talking about tuberculosis, and he'll be explaining more as we are summarizing our presentation. So, Mr. Japhet, I don't know, I've been trying to reach you. I don't know which country you are in right now, because I don't know. So, if you can get me, kindly explain to us what is tuberculosis, how it spreads, and everything you think it's important for us to understand on tuberculosis. So, Mr. Japhet, I know you're on the line, so the floor is yours. Welcome.
Good afternoon. Good evening, dear colleagues, wherever you are. I, Japheth Odera, and my co-presenter, Martin Sironka, are delighted to present to you our case study on tuberculosis, commonly known as TB in our health facilities. Our presentation is divided into different components. We have the introduction, how tuberculosis spreads, the examples, the symptoms of tuberculosis, prevention and treatment, and drug resistant to TB. I start you off by saying that tuberculosis, popularly known as TB, is highly infectious airborne disease caused by bacteria which affect the lungs, but it can also target other vital organs like the kidney, the spine, and the brain. Immune system can contain the bacteria at an early stage, which is called latent, and when it becomes active, the system fails to contain it, and it ends up spreading into the body organs. They spread from one person or animal to another, or from a contaminated surface to a person. How does it spread? Two components, through respiratory droplets and direct or indirect contact. Respiratory droplets, when an infected person coughs without covering their mouth, sneezes, speaks, sings, tiny infectious droplets are released into the surrounding area, which are inhaled by someone, and that can cause the disease. These airborne particles from an infected person's cough or sneeze, which are also influenza, when in active form affect the lungs. At this stage, immune system of the body fails to contain it, and it affects the system. Immune system can only repel it when it is still at an early stage. Direct or indirect contact. Touching skin or exchanging bodily fluids, or touching contaminated surface and then touching your face can cause common cold, influenza, the flu, or the COVID-19. You remember during the COVID, we were asked not to touch things, and we were hand washing with plenty of water and soap. Common examples of tuberculosis. Viral infection. When you talk of viral, that is when it is in the atmosphere, and that is where viral infections like COVID-19, influenza, that is the flu, and common cold. Another example, which is now based on TB, is the bacterial infections, which is the TB and Salmonella. These diseases, they range from mild, self-limiting infections to severe. When it becomes severe, then it becomes life-threatening conditions. And what are the symptoms when you want to know somebody has this disease? The symptoms are active TB presents with a prolonged cough. Sometimes it brings up blood, persistent fever, night sweats, fatigue, and unexplained weight loss. Preventions and treatment. Preventions involves avoiding close contacts with the active TB cases, wearing of masks in high-risk environments, and treating latent infections to prevent progression. Number 2, completing a strict 4 to 6 month course of everyday oral antibiotics to fully cure the disease and stop drug resistance. Number 3, vaccination. We know the vaccines are widely used to prevent severe and life-threatening form of TB in young children. And the last one, number 5, infection control. Avoiding high-risk or congregated settings like crowded classrooms, public transport system, healthcare facilities, proper ventilation, isolation of active cases, and personnel protective equipment such as putting on N95 mask are critical to stopping airborne transmission. And the last one is the hygiene and cough etiquette. Cover your mouth and nose when coughing or sneezing, and avoid prolonged close contact with anyone exhibiting active TB symptoms. Drug resistance. Drug resistance of the TB occurs when tuberculosis bacteria mutate to survive the powerful antibiotic designed to kill them. This resistance usually develops due to incomplete treatment causes, improper medical prescriptions, or poor quality medications. It can also be spread directly from person to person. Drug resistance are classified into three primary levels. That is monoresistance, which is the bacteria resist at least one first-line TB medicine. Number two, multi-resistant. The bacteria resist two most critical first-line drugs. And number three, extensive drug resistance. This is where the severe form of resistance that also resists second-line fluoroquinolones and at least one other injectable drug, leaving a patient with incredibly narrow survival options. At this level, the patient frequently experiences the debilitating permanent side effects such as hearing loss, kidney damage, severe nausea, and liver distress. When it gets to that extensive drug resistant, it affects the economy, it strains the economy because it demands prolonged isolation, complex testing, and expensive specialist pharmaceuticals. It places an overwhelming financial burden on patients, families, and public health care budget. And again, you find it now become costly diagnostics at that level. It cannot be identified with basic microscopic testing. It demands advanced molecular testing and laboratory cultures that are really accessible in low-income or rural settings. As a result, the CDC reported that only about 2 to 3 people living drug-resistant TB were able to access necessary treatment. So brothers and sisters, that is our presentation, and let's take care. TB is life-threatening. Thank you and God bless you.
Thank you so much. Thank you so much, Daktari. Daktari, that's somebody very knowledgeable. And so that's it. Let me hope you've understood. We have talked of the prevention and treatment measures of tuberculosis and everything. He has talked of the DRTB. He has talked of very many things. And so let me hope we have understood everything. He has also talked of the risks and types of the DR and everything. So thank you so much, Daktari, and thank you for watching. Thank you for watching. This is the crew. We have the executive producer Jane Kagwanja and Faith Mbide. We have the director and everybody, the cinematographer, the sound engineer, the video editors, the broadcast technician, and finally the presenter.